this obviously is broken. They need help, they want help, they're given cash, but it's not the same thing. There's some things that money can't buy, and it seems in this country, money can't buy you proper mental health support for teenagers.
So the Prime Minister, Andy Burnham, says he might increase the conditions on people required to have benefits. He's been speaking to the BBC's Laura Kuenssberg.
It's about changing the nature of the support and making some of the support conditional upon people taking opportunities that are presented.
So you might increase the conditions required to receive benefits.
Has given guarantees of opportunities for young people, and I think we need to continue down that approach, and where mental health support is needed, for instance, is provided in work to support people in an opportunity. Let me just say something more, though, about what you're driving at, which is the welfare bill. I think we've got to get really serious as a country at getting the welfare bill down. Often that just pushes people into even more crisis and then even more public spending in another part of the system. We need a system that sets people up for success rather than pays for failure.
That's Andy Burnham there. Well, the Times newspaper reveals this morning that thousands of 16 and 17-year-olds are receiving more benefits than they could get from working.
More than 87,000 16 and 17-year-olds are claiming those personal independence payments. That's a non-means tested benefit intended to cover the extra costs of a disability. More than two-thirds of those are on the upper tier. That's worth £194 a week. They're claiming for conditions like anxiety, depression, autism, ADHD.
But a 16-year-old working 12 hours a week, the legal maximum during term time on the under-18 minimum wage, would take home less than half that amount. Is that an example where the incentives are pushing people away from work? Fraser Nelson is a Times columnist and he's an expert on the benefits system, and I'm delighted to say he joins us this morning. Fraser, good morning.
Good morning.
So we know that the welfare state is very much on Andy Burnham's radar. It couldn't really not be, given how much of the government budget it takes up. But we're starting to see, I'm sure you'll be perfectly aware of the number of problems within it, not least the fact that many people seem to feel it is disincentivising people from work. Let's have a look at this Times front page specifically. The personal independent payments, the rise in 16 and 17-year-old claimants, and the rise in the number of 16, 17-year-olds who are claiming for what they call neuroclinical or neurodiverse conditions like anxiety, depression and autism. Is this a real thing? Have these conditions increased, and should we be helping people with money to help ameliorate those situations?
Well, of course, mental health conditions are being diagnoses are going up all over the world, but they haven't doubled, and that's what's happened to the amount of payments we're giving, not just adults, but interestingly, 16 and 17-year-olds. They can now claim something like £86 a week for anxiety and depression. And this is the same amount as you would get if you're a 30, 40-year-old adult. Now, this is a fault of the system. It's a quirk of a system. I'm not sure that when the PIP system was designed, we thought that we would be spending almost £1 billion on mental health disability payments to the under-21s.
What are these kids supposed to be spending this money on? If you're getting 194 quid a week because you've got anxiety or depression, what's that money for?
Well, if you ask me, that's the big flaw behind PIP. It's supposed to compensate people for the burden of living with a certain condition. For example, if you've got Down syndrome, you get that sort of money as well, but it's a little bit more, not very much more. But it's just cash. There isn't any conditions at all. And quite often what people want is help. If you're a kid, for example, that you want to try to get a mental health appointment, then there is a waiting list. Something like half of them have been waiting more than a year to get a simple mental health appointment. So we've got one part of the system broken in that way through lack of funding and lack of resources, while the other part of the system is giving cash payments to kids registering with anxiety, depression, autism, etc. Now, this obviously is broken. They need help, they want help, they're given cash, but it's not the same thing. There's some things that money can't buy, and it seems in this country, money can't buy you proper mental health support for teenagers.
We've got a real problem with these young people not able to find work, particularly, let alone education and training. And yet it does seem as if the welfare system in this instance could even be working against them being able to find a job.
Well, it's actively working against them. When you look at the financial incentives, you need to ask, what is the government saying to the people, not through its press releases, not through what Andy Burnham says on the sofa. What do the incentives say? The incentives say that if you register as being sick or disabled, mental health, anxiety, etc., then the cash comes pretty quickly. If you want to get a job, then this road ahead of you is flinty and it's quite steep. And that is the wrong way around. And what is concerning is how many of these child welfare payments, whether it's child disability or living allowance and PIP, then convert straight onto worklessness and sickness benefits without any real chance of entering the workplace. Now, that system is not a system that's fair to kids. It's heavily incentivizing them to get a diagnosis rather than get qualifications, to claim rather than to work. Now, you can see the imbalance here. I'm not sure, for example, the minimum wage is significantly less for 16-year-olds than it is for people 18, 19, but the benefit payments are exactly the same. Now, should you really be offering kids adult-sized disability payments for registering with mental health? Or should you be putting more money into the mental health support, which is being outrageously denied for children who ask for it all over the country? That's the sort of question Andy Burnham should be discussing, and it seems as if he is reform-minded, put it that way. There's a lot to get his head around here.
I wonder if we're in danger of creating, or have already created, a work-shy generation. I mean, Rosie Wright, who is sitting here, and Rosie, my colleague, my co-presenter, spoke earlier to Haroon Chowdhury from the Centre for Young Lives earlier in this programme, and he was really articulate about the youngsters that he meets and speaks to who don't want to be workless. They don't want to. They're not. He called them not shirkers nor snowflakes. And I just wonder whether your experience of doing research into this area, have you found that young people want to work, or do we have a problem that has been exacerbated by COVID that we simply haven't solved in creating that desire to go to work and that resilience in young people to be able to do it?
No, this is a bit of a canard. There is absolutely no diminishing young people's ambitions. Of course they want to work. Of course they want to build a life for themselves. But they're up against a system that heavily disincentivizes that. The system incentivizes them to skip out the economy, to go and sit on the sidelines. That's where the fastest money comes from. And that is the problem. This badly designed system is creating massive gaps, and thousands upon thousands of children are falling within those cracks. It's not a question of being work shy. It's simply a question of whether work is rewarded. And in this country, compared to welfare, that differential is nowhere near good enough. The work incentive has been not just weakened, but in many cases eroded by a welfare state, which in many places is doing more harm than good.
But putting aside the welfare disincentivization from young people for the moment, are the jobs actually out there, and do we have effective enough ways for helping people get into the workplace?
Well, yeah, of course. I mean, the jobs are out there. We've still got hundreds of thousands of immigrants coming to the country every year to take these jobs. We're talking about entry-level jobs here. There are lots of entry-level jobs. There are still lots of employers who struggle to find the workers. And we've got a minimum wage being put up as well recently, one of the highest minimum wages in the world right now. But the problem is, of course, that the welfare system means so often that for every extra pound you earn, you lose something like 60, 70p in welfare. So that is what I mean when they say the work incentive is blunted. Those are the mechanics that need broken. And you need a wholesale review of a system from start to finish, so policymakers can finally start to see it from the perspective of the users. Right now, when you look at the other end of the telescope and you see how the welfare system looks to kids who are on the brink of going into school. I mean, somebody who's 16 and is about to go to an alternative provision school place has got a huge chance of being a NEET in later life. There is a pipeline we're creating, not from school to work, but from school to welfare. Now, that isn't fair in the young people, it's not fair in society, and that's what needs to be changed pretty quickly.
Thank you, as ever, Fraser Nelson, Times columnist, talking about the serious problem sitting right in the middle of Andy Burnham's lap, which he has started to address, but we've had no firm policy announcements as of yet.